All right, welcome back to Training with Healthcare Unlocked. Again, my name is Ian Sanders. Today, we're going to look at the end part of the script when you're right up until the point where you're going to do the application. So, this is going to be pretty quick, pretty easy. We're going to be looking at this portion here, benefit presenting guideline, and it really is just a guideline. And I'm going to explain each different part without getting into detail or without actually describing a plan today. And that's just so that you get a basic idea of what you're going to need to know. So what we're looking at here, when you go through this, the format of it is always going to be the same. You want to review what you went over with them in the beginning, and that's why taking notes is going to be important. You want to explain how the plans that you picked out for them meet the needs of what they were saying that they wanted. And then you want to ask them if there's anything else that you might have missed. This is going to give you the greatest chance for success. So an example of this going through the script. Hey John, this is Ian, and I was able to put a great plan together for you based on what we talked about in our last conversation. Do you have that pen and paper handy? Because I want you to write a few things down as we go through it. All right. So first, you said that you wanted to make sure that it covered your doctors and your hospitals. Is that correct? And so you're going to want to go over those particular things in the plan. All right. And then the name of the company is, we'll just say Blue Cross Blue Shield. And the name of the plan is the Silver Six. So they're writing this down. And it has, and then you're going to go over the deductible, the co-pays, the co-insurance, the prescription costs, and then you'll go through any supplemental coverage as well. And you want to do it in these orders and make sure that you don't miss these things. And then, all right, John, was there anything else you wanted covered in this plan that we didn't go over? If they say yes, let's say, oh, well, I wanted to know how it covers chiropractic care. I want to know how it covers mental health. At that point, you can go over that stuff with them as well. All right. And if not, then you just go over the costs. Perfect. You said that you could afford to spend, let's say, $200 a month to cover your insurance coverage, right? Now we are at, and what you're going to do is all the totals of everything, the major medical insurance or the ACA plan, the cost of any supplement plans that are there, dental vision, all of that. And you want to always make sure that it's a little bit less than what they said that they could spend, unless you've already had a conversation that they needed to bring that amount up. So if they said they could spend 200, let's say that it all came to 175. Perfect. You said you could afford to spend $200 to cover your insurance. Right now we're at 175. Does that sound good? Of course, if they said 200 and you're giving them 175, they're going to say yes. All right, great. So I want you to write down the individual policies that are part of this plan. And at that point, you're going to name each company and the type of plan, give the cost of each plan, and explain that you'll be doing the applications for each plan, starting with major medical and the process. So what that means is that, say you're doing a major medical plan, a dental, a vision, and a supplement plan. What I would say in that instance is, all right, I'm going to be doing a couple of applications for you all at the same time. What I need from you is just going to be your social security number. We'll verify your address, your phone number, all of that basic information. Make sure you have everybody's date of birth. And for the ACA plan, you'll get an email that will ask you if you're ready to pay, and you'll pay that way through that link. You don't have to worry about it. But for the others, I will need to collect banking information so that they can bill you that way. That's just the way it works. So you want to make sure that you have that okay. Now, once you've explained how all of that works so that there's no surprises, because the last thing that you want are surprises when you're talking to your clients, because that's the quickest way for them to say, you know what, I don't need to think about it. I'm not sure. The moment that they get surprised, they're going to take a step back. So you don't want that to happen. And the way that you can avoid that is by simply explaining it all from the beginning, and then dealing with it before it becomes an issue. Now, at that point, they're comfortable. They like what they have. You'll go ahead and begin the application, and we will go over that in the next few videos. Until then, you have a great rest of your day.